Okay. Good evening, everybody. We are here again for today's online fertility seminar. I'm here alone for now, so I'll wait for others to join me. Yeah, so I'm just activating the income messages, the chat box. I'm dropping my message. Hello, everyone. Hello. Okay, let me pass it on. Hello. Welcome. Thank you. Okay. Is okay, so my welcome message spins. Thank you once again, like I said, for joining us. So we will be having the presentation. Okay. Just want to be sure that they're here. Hi, Margaret. It's so good to see you. You're able to join us today. Thank you so much for being here. Okay. Let me go back. Let me see what I sent. Let me check. So I want to just open. Pardon my knowledge. I'm trying to. Okay. Okay. My problem now is to know if everybody can see it, because okay. So let me see. Present window. Share. I'm trying to share my screen. We are learning how to use technology. Okay, so welcome. Today, like I said yesterday, we are focusing on the topic improving sperm health. That's the topic we are focusing on today. That's our topic for the seminar today, improving sperm health. Yes, we have Florence joining us. Yeah. So yesterday we were able to talk a lot about what the common mindset is concerning sperm health and its implication in the pregnancy process, and we're able to debunk some facts that just for the fact that a man ejaculates doesn't mean that the sperm is healthy. We talked about the components of the sperm having two parts, the cells itself and the seminal fluid. We said that the presence of seminal fluid doesn't guarantee that there is presence of cells, sperm cells, and that even the presence of sperm cells doesn't guarantee that they are healthy enough to achieve pregnancy. We went ahead to talk about how poor sperm health can impact pregnancy outcomes. So we are going to be expatiating on how that happens in our topic for today, and then conclude by how we can get the best quality of sperm health so that we can be having very healthy pregnancies. That is our focus of discussion for today. I wish more people can join us. Let's see if we can get a few more before we get down to the main topic for discussion. So welcome Florence, welcome Margaret, and welcome Tawa. We have 3 people that have joined us here. Thank you very much for being part of today's seminar. You can mute your microphone so that we don't get holdbacks. You can see the chat box at the lower right end of your screen. And if you click on that, you'll be able to just send in any message. Please put down your questions in that chat box. I will see it just as we are talking, and I can respond to them as we continue. So we have at least about 5 to 6 people with us now. And let's just start, and hopefully other people will join us as we continue. Okay, so getting down to it, improving sperm health. What is sperm health? That's the first thing we should look at. We're talking about sperm health, sperm health, sperm health. What exactly is it? Sperm health basically refers to the health condition of a semen sample. Okay, the health condition of a semen sample. We have been talking about it. Somebody has just joined. Welcome. Good evening. Mary Albert, thank you for joining us. So sperm health basically refers to the health condition of a semen sample, how healthy it is. Like I said yesterday, we were talking about the components and what part really matters. We talked about sperm health yesterday, and we were saying that you do not assess the health of sperm sample or of a sperm sample by its color. You do not assess the health by its quantity, and you do not assess the health by its consistency. You can't say, oh, because this sperm looks very white, very bright, that means it is healthy. No, you cannot say, oh, this sperm sample is very plenty. Oh, what was released was a lot. That does not guarantee or talk about its health. You cannot say, oh, this sperm is very thick, so it's very healthy, or it's very watery, that means it's not healthy. No, those are not the criteria for qualifying the healthiness of a sperm. So sperm health refers to the health condition of a semen, and we say it is important to note that the semen sample is made up mainly of 2 parts, seminal fluid and the sperm cells. I said that in the beginning. Now, there are 3 major parameters for measuring optimal sperm health. Sperm health involves having sufficient sperm quantity. Optimal sperm health involves having sufficient sperm quantity, that is the count. That's the first parameter for measuring sperm health. Good movement, what we call motility, that is the second parameter for optimal sperm health. And a normal shape, that is what we call the morphology. That is the third thing that we use in qualifying how healthy a sperm is. Not the quantity of the ejaculate. So we said there that it is made up, a semen sample is made up of 2 parts, seminal fluid and sperm cells. You can never see the sperm cells. What you actually see is the seminal fluid. Floating inside of that seminal fluid is the sperm, or are the sperm cells. Now, what the semen looks like is not what tells us how healthy the sperm is. And I said You can't say it is healthy because it's whitish, or you can't say it is unhealthy because it doesn't look so white, it looks a little bit off-white. You can't say it is healthy because it's copious, plenty. You can't say it is unhealthy because it is not so plenty. You can't say it is healthy because it is thick. You can't not say it is not healthy because it looks a little watery in consistency. Those are not the parameters for concluding on how healthy a semen sample is. The parameters for talking about sperm health are: one, the count of the cells inside the semen sample; the motility, how fast and the direction at which they swim or move; then thirdly, the shape of the cells. So our interest is in the cells, not in the seminal fluid or what it looks like or how copious it is. No, but the cells that are found inside that semen sample, inside the seminal fluid. That's what will tell us how healthy the sperm is. Okay, so we have said the parameters for sperm health is what we are talking about now. Sperm cells are produced in the man's testes. Everybody should know that. Seminal fluid is produced in the prostate gland. Sperm health parameters focuses on the condition of the sperm cells. That's what I just said. The sperm cells has no serious business with the seminal fluid. The seminal fluid is majorly a function of diet composition of the man. Are you drinking enough water? Are you eating certain things that will make the color of the seminal fluid what it is, or that will make the consistency of the seminal fluid what it is? But that has no business with the sperm cells being produced from the testes. Okay, so sperm cells depend on the anatomy of the testes, the hormones, and their functionality. So yes, so what is it that determines the cells now? What determines the health of the cells themselves? It is basically from the anatomy of the testes, hormones, and functionality, how healthy all of that is. Will now determine, okay, all those will now determine the condition of the cells that will be produced. Okay, those are the things that will now determine the condition of the cells that will be produced. That should sink. The state of the testes, the hormones, okay, and the functionality of all of this with the health condition of the person will now determine what the cells will look like and how healthy they are or how healthy they will be. Okay, so that is the determinant of the health of the sperm. Now, a healthy sperm count, we said there are three parameters basically: the count, the motility, and the shape or morphology. Now, a healthy sperm count is typically considered to be 15 million or more sperm cells per milliliter of semen. So that liquid that is ejaculated, if you take 1 ml of it, we should have about 15 million of the sperm cells inside. That is when we can say this sperm is healthy with respect to the count. This is said to be the minimum quantity optimal for achieving pregnancy. For those who have gone through our counseling sessions, we say that we need this quantity. Yes, we all know from common biology or from basic biology that we need just one cell, right? One cell to achieve conception, to fertilize the egg. But here we are saying we need about 15 million cells minimum for achieving pregnancy. The reason is because of the distance that the sperm cells have to travel and because of their microscopic nature. They are very, very tiny cells that you cannot see with the ordinary eye. So when they are deposited in the vagina, they all help themselves, push each other, struggle, and a few of them get to the fallopian tubes. These 15 million will not get to the fallopian tubes, no. But the more they are in number, the better the chances of some getting to that fallopian tube. So we might have like 10 thereabouts getting to the point where fertilization should take place. So if the number is less than this 15 million, they will not be able to reach there. That's the idea. Okay, so that's that for the count. Now, for motility, it is said that at least 40% of this quantity. So if you have 15 million cells, 40% of them, okay, 40% of them, which is like 6 million, should be able to move in the direct position. That is, they should be able to exhibit forward movement. They should move in a straight direction. If they are going around in circles, they are not healthy because they will not go to where they are supposed to go to. If they are moving backwards, they are not healthy. All right. So we should have optimal range 40 to 60% of cells moving in a forward direction. So they are deposited. So you see, the entire anatomy of intercourse is even supposed to encourage this. We need to understand how humans were created. So that positioning for intercourse, the positioning of the insertion, the penis getting into the vagina, you can see it's already encouraging forward movement. It's already encouraging straight movement. So the cells are deposited there at the fornix of the cervix, that is at the topmost part of the vagina, and then they find their way into the cervix. They should just keep going straight like that to where the womb opens towards the fallopian tubes. So we are saying that at least 40% of them, but if we get 40 to 60% moving in that forward motion, we will be happy. Okay, so the third parameters for optimal sperm health, or for checking how healthy a sperm is the shape. Even though the shape is not as important as the quantity or the motility, but having a good percentage, having the normal shape is beneficial. Okay, so a higher percentage of sperm having normal overhead and long tail is okay. If you have a good quantity with the proper shape, moving in the right direction with the right quantity, we are hopeful that at least healthy sperm cells will get to the point of fertilization and fertilize the egg. So that is what healthy sperm is. The quantity, 15 million or more. The motility, 40 to 60% of them moving in forward direction. The shape, having a normal shape. This is what a normal shape looks like. Okay, so this here, these first two are the normal shape of sperm cells. All right, overhead, with the neck and then a long tail. That's what a normal sperm cell should look like. If we have a micro head like this, or a pointy head like this, or double-tailed or double head, or flattened head, or a very short tail, these are abnormal sperm cells. All right, we will talk about what can cause this to happen, but this is what correct sperm, I'm trying to put correct sign with. This is what correct sperm cells should look like. If we have them looking like this, then with the right quantity and the right motility, we will be happy that we have good sperm cells to help achieve pregnancy. So how do you know healthy sperm? We have said that the way to know it, you cannot see the sperm cells with your eyes. So the way to ascertain that sperm is healthy is by what we call the semen analysis. The semen analysis is the most reliable method to assess sperm health. And it is the one that measures the count, it measures the motility, and it looks at how many of them have normal shape. Okay, so what it means is that poor sperm health is characterized by low sperm count or zero count, poor motility, and abnormal morphology. These are the three criteria for saying that this sperm is not healthy. Not the color, not the quantity of the semen, not the consistency of the semen, because a lot of people still believe that the sperm is thick or watery. That tells how healthy it is. Or if it's white or brownish, that tells how healthy it is. Or if it is copious or not, that tells how healthy. No, the parameters are the count, the motility, and the shape. Okay, remember that you can ask questions as we go on. You can just drop your questions. That's the advantage of using this Google Meet. If it is on WhatsApp, putting questions in between the chats will be confusing. So we say wait for the questions till at the end of the lecture. But right now, as you remember, you can put down your questions so that you don't forget them. So how we know sperm is healthy is through the semen analysis test. So let's look at causes of poor sperm health. What makes sperm unhealthy, or what causes this poor health? We have said that the poor health is when the count is low, or when the motility is poor, the number moving forward are poor, or when the shape is not the correct shape. So what can cause this to happen? What can cause this to happen? That is what we want to look at right now. So causes of poor sperm health. Poor sperm health can be caused by a variety of factors. It's important to know that. Let's look at number one, medical conditions. Okay. So for some people, if they have some genetic abnormalities, okay, or things like undescended testes, things like infections, things like hormonal imbalance, varicocele, cancers, diabetes, autoimmune diseases, kidney problems, some drugs even, all these can impact negatively on the health of the sperm. They can cause the counts to be low. They can cause the motility to be poor. You know, basically medical conditions will cause reduced counts and motility. Some genetic abnormalities, like people who have something like cystic fibrosis, where fibrous tissues grow in between organs. So if we have fibrous tissues growing inside of the testes, for people who have a genetic abnormality called cystic fibrosis, that testis will not be able to produce, so it will affect count. Okay, for undescended testes, for some reasons, these people have poor descent. So when the baby boy is in the womb, the testes are not out, somewhere around 4 months thereabout. But as the child is getting towards 10, the testes should come out of the body. Okay, and we'll talk about the significance of the testes. So initially they start from the stomach. Okay, initially they start from the stomach. That is the testis. It starts growing from the stomach, but eventually, before the baby is born, the testis should come out of the stomach into the outer part of the body. Okay, so when there is a genetic problem, you can have something like undescended testes. Infection is another thing that can cause poor sperm health. It can reduce count and literally kill the cells. So, of course, reducing count thereby. Hormonal imbalance can also cause a defect in the production. Men also have hormones. Men can also have hormonal imbalance. Yes, there are cases like that. So in the case of hormonal imbalance, production will be affected. You can have low sperm count. Varicocele is a condition where, yeah, good evening, thank you. Okay, so we'll attend to the questions. Just keep them coming. I will go through all of them. Thank you for the question, Favor. So we've said hormonal imbalance can cause poor production, so leading to low sperm count. Varicocele is a condition where there is a slowing of the blood flow around in the veins surrounding the testis. So outside there in the scrotal sac or the scrotum, you have the testes, the two testes. Surrounding the testes are some blood vessels, okay? So they supply oxygen to the testes, take out waste and all of that. If for some reasons we have stasis of blood flow because the veins are swollen. So in varicocele, the veins are swollen around the testis. So it will make the blood not to flow as fast as it's supposed to flow. Now that slow flow of blood will be bringing heat. You know, blood is warm. We'll be bringing heat to the testis, more heat than it can handle. That will cause automatically a reduction in production of the sperm cells, okay? So causing low sperm count and motility, of course. Then things like cancer, if you have testicular cancer, sugar in diabetes, or even just impaired glucose tolerance can cause low production of sperm cells. Of course, autoimmune diseases can cause that, kidney problems, and some drugs like cancer treatment drugs, antihypertensives, these cause reduction in the production of sperm cells. So these are medical conditions that can cause poor sperm health. Now, I want to look at environmental factors. Environmental factors like exposure to toxins, okay, like heavy metals, pesticides, industrial chemicals. These ones now can cause affectation of the morphology of the cells, okay? Toxins can cause an impact as well as radiations. Toxins and radiations can impact negatively on the shape of the cells. They might not directly affect the motility or the count, but they can affect the morphology of the cells. There are some toxins that can interact with the body, maybe interact with hormones, what we call endocrine disruptors, interact with hormones and cause reduction in the production of the cells as well. Now, overheating of the testis. Overheating of the testis can cause low production of sperm cells. And by overheating, happens when you wear tight clothing. So in this era where men no longer wear free-fitted trousers, it is a problem. It's one of the reasons why we teach our young ones how to take care of themselves now to avoid fertility problems in the future. So just because a man wears, okay, like in our time now, we have skinny jeans. It's fashionable, but it is wrong for men to wear tight trousers. This is because it automatically increases the temperature around the groin. And this is so dangerous for the testes because it will increase temperature, affect production, and then you have the man having low sperm count because the testis becomes too hot, can no longer produce. The reason why God created the testis to be outside the body is because it needs to be cool to produce. That's how it was created. So when we now increase the temperature around the testes, as simple as that sounds, it can go a very long way to impacting negatively on sperm health. So just wearing nylon-based underwear, okay? Some people wear these tight kind of boxers that just grabs everywhere. Then if they are not made of cotton, that doubles the problem, all right? And then in this era where fashion is encouraging men to wear skinny jeans, it is terrible, or tight-fitted trousers. It is wrong. It is not just the way men should dress. Originally, if you look at the original fashion of trousers, it is free. That flap area is so free. It allows space around the groin. The reason is because the testes should not have any kind of heat around it. So tight clothing is very dangerous for sperm cell production. People who also indulge in hot tubs or saunas are exposing the testes to unnecessary heat, jacuzzis, people who are always exposing themselves to jacuzzis. These are dangerous practices for sperm health. Not that you cannot bathe warm water when it is cold or things like that, or maybe use jacuzzi in very cold situations, but it shouldn't be a common practice. Now, long distance driving also is a problem. And for long distance driving, the issue is that the heat, especially for a particular type of vehicles, those ones that have the engine under the seat and things like that, those cars that don't have a proper bonnet, so the engine is somewhere under the seat and all of that, the heat emanating from all of that machinery in the vehicle is directly on the testes when you sit down on those kind of chairs. Okay, so the heat for people who do long distance driving and they are always on the road every day, it is dangerous to their sperm cell production. These are the reasons why we are having these challenges increasing in our own generation. In the olden days, men used to tie wrappers. So that area is always aerated. They go to farm, they do fishing and do all of that, and then come back home, stay outside, enjoy the cool breeze before they go retire for the night. All of that encourages a healthy atmosphere for the testes. But in a situation where you are wearing tight clothing, you are sitting on vehicles, you know, that have heat radiating around the groin, and all those practices, all those are very, very unhealthy for the testes and can impact on their production. And then you see things like low sperm count or zero cell count in the semen. Okay, all these can damage sperm cells themselves or damage their production, or just cause reduction in their production, and then we have what we call low sperm count. We want to look at lifestyle factors because this one is also very important. Lifestyle factors that can impact negatively on sperm health are things like large or excessive intake of alcohol. Now, I'm going to be very specific with alcohol because in as much as we are not saying do not drink at all, we encourage people not to overdrink. When you drink more than is required, the tendency for the sperm health being affected increases. Okay, so we encourage men. Yes, men like alcohol. They love their bottles. That's what they use in hanging out, relaxing, and things like that. But medically, a glass of wine is recommended. Medically, a bottle of beer every 2 days is recommended. Taking excessive amounts more than that regularly can directly impact on the production of sperm cells. Smoking is another problem. The use of illicit drugs is another problem. These are, of course, chemicals that can impact on the hormones and affect production, impact directly on the production process, and cause low production of sperm cells. Obesity is another important thing to note. Men who are obese, particularly people who just acquire obesity in adulthood, have hormonal derangement. This is because fat cells, and I know we have taught this, especially when we are talking about women, fat cells produce some hormones, and unfortunately, they produce female hormones. So when a man has obesity, the quantity of female hormones in his system is higher than normal, and it will suppress the testosterone, which is the male hormone, thereby affecting production of the sperm cells. Remember that what produces sperm cells in the man is the testes powered by testosterone, which is the hormone. Okay, so but when a man is obese, Then the female hormones, unfortunately, what the fat cell produces is estrogen. It will suppress that testosterone and then cause it not to allow for improved sperm production. Prolonged use of steroids, like for people who take steroids for muscle production and all of that, or if they are having medical reasons why they are taking steroids, like people who are asthmatics, it can impact negatively on sperm cell production. So it's important to take note of that and be mindful of how you use them. Stress can affect sperm production and quality. Okay, stress, because of the stress hormones, which can now suppress the reproductive cell hormones, which like that is the testosterone, can impact on the production and allowing it to have low production, low sperm counts, and low motility. So other factors like trauma. Trauma is not necessarily a lifestyle, it's not a medical problem, okay? But it just happens that some people growing up have traumatic accidents, maybe road accidents, or things as funny as during football playing, what we call blunt testicular trauma, blunt testicular trauma. Now, any injury directed on the testes can affect the cell structure of the testes and then impact on its production. All right, some people have injuries, accidents in childhood or early adulthood, and then by the time they are ready to start having children, they cannot. Or even in adulthood, you have an accident that can maybe damage some of the veins around the testes. All this can affect the testis' ability to produce sperm cells. Okay, so some surgical procedures like poorly done hernia. Funny enough, if you go to some funny places, let me not just dwell so much on that, but there are some medical practitioners that have no business doing certain things. Okay, if you've not been properly trained, you don't have enough experience, and out of greed or whatever, you just open a hospital and start doing all sorts of things. You might damage people's bodies in the name of doing surgeries that you are not trained to do. That's why it's very important to be intentional about selecting your healthcare provider. Make sure you are dealing with specialists, properly trained people, and just make sure you are in safe hands, because people have gone for some surgeries and then they got complications out of it. And one of the things that can happen is damage to the reproductive cells. Okay, so poorly done hernias. This is the reason why some men, you tell them to do any surgery that has to do with the reproductive system, they will say they sent you from the village, that the village people have sent you. Things even as simple as hydrocele, varicocele, some people don't even want to be involved, because truthfully, if a surgery goes wrong around the reproductive system of a man, it can cause from impotence, that is inability to have erection, okay, to even production of sperm cells. Maybe the person will be able to have erection but unable to produce sperm cells. So surgery around the male genital tract is very, 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 very sensitive. Very sensitive. So that is why you should, as much as you can, make sure that you are dealing with professionals when it has to do with any kind of surgery. You know, young boys, your nieces, your nephews, or people close to you that want to have surgery as children, encourage their parents to take them to good places, not just anywhere. Because if something goes wrong in that surgery, even as a child, it is when the young boy has grown up to a man and wants to have his own family that there will be issues, that it will show that something went wrong. You might not know at that time. So don't risk the lives of male children. They don't know anything. Anywhere you take them to, they'll just go and they'll just submit themselves like that. All right. So be very careful when it comes to surgery for boys, for the boy child, or even for men. You have to be very, very careful so that damage is not done, because many of the damages done, once done, might not be reversible. and then the person ends up with reproductive health challenges as a result of something that was supposed to be a simple surgery. Just like you have for women who go for something as simple as appendectomy, just to remove appendix, and then they've destroyed their fallopian tubes, and they are unable to conceive spontaneously for life, you know, and things like that. So the same way it happens with men. So it's important to note that surgery is an important factor to cause poor sperm health. Finally, age. Age, well, once a man grows or a woman grows, health declines generally. Stem cells or sperm quality and production also declines with age. It is said that once a man is 40 and above, the production begins to decline. The production begins to decline. Not that it stops. A man does not ever stop producing sperm. At 70, he's still producing. As long as the man is alive, he's still producing sperm cells. But of course, it will not be the same as when they are in their 30s or 20s naturally. Of course, it doesn't mean that a man at 70 cannot impregnate a woman. Of course, we know that men, even at 70, can impregnate a woman, but it will not be like when they were younger. That's just obvious. And at that age also, you can now start having more of genetic abnormalities because the cells are old. There is a lot of maybe DNA fragmentation and all of that happening in the cells at that age. And then even though they are impregnating women, the children might come up with some kind of birth defect or deformities or abnormalities of one thing or the other just because of the age of the sperm cells. So it's important to also take note of that. Next, we are looking at sorry, I'm having a technical glitch. Okay, sorry. So we want to look at the implication of poor sperm health on pregnancy outcomes. So we've talked a lot about sperm health, how we will know sperm health and the causes of poor sperm health. Now we want to see the implication of poor sperm health on pregnancy outcome. Poor sperm health can negatively impact pregnancy outcomes. We talked about some of that yesterday. So that can potentially lead to 3 problems. Okay, how sperm health impacts on pregnancy outcome is in 3 ways. 1, difficulty in conception. 2, increased risk of miscarriage. And then 3, birth defects. So problem with sperm cells can affect pregnancy outcomes in 3 ways. 1, it can make it difficult for the conception to take place. Okay, it can make it difficult for conception to take place. 2, it can cause increased risk of miscarriages. We talked about that yesterday, that yes, sperm cells have been implicated as one of the causes of miscarriages. We will see how and why. Then poor sperm health can also lead to birth defects. We just talked a little bit about that now, where there is aged cells with some DNA abnormalities as a result of age and some other things can cause birth defects. Birth defects are physical abnormalities in a child born, in when a child is born. So either the ones you can see or the ones that have happened inside. You know, some defects maybe in the heart or things like that. So these are the 3 ways that sperm health can impact negatively on pregnancy outcomes. So let's look at them one after the other. Difficulty in conception. Low sperm count or poor sperm motility significantly reduces the chance of a sperm successfully reaching and fertilizing an egg, leading to infertility. If you don't have enough quantity, like I explained, the sperm cells will not even get to the point of fertilization. If they are moving too slow, or the number moving in a straight direction are fewer than 40%, then we don't have enough sperm cells getting to the egg to fertilize it. And of course, no fertilization, no pregnancy. What we will have is infertility. So that's for poor count and motility. Poor sperm quality can affect outcomes even in things like IVF or ICSI. Okay, so if the quality of the sperm is low, not optimal, even for things as specialized as IVF. You know, in IVF, you have taken the sperm, you have mixed it directly with the egg. But if the sperm cell itself has a problem, it might not fertilize the egg. And even if it fertilizes the egg, it might affect embryo development. Because pregnancy is not just about the sperm and the egg meeting. Even if fertilization is successful, you now need the embryo that has been formed to develop. It takes a few days for that to happen, roughly 2 weeks. When that development has taken place, the development is just the cell dividing. Okay, so when the sperm and the egg meet, they now form an embryo. The nucleus is fused. Then they begin to divide. Divide into 2, divide into 4, divide into 8, divide into 16, into 32. They continue to divide like that until the baby begins to take form. Now, that division stage, if the sperm cell is bad, if it is poor in its health, then it will affect that division. And it is when those cells have divided, they can now transfer, it's dividing rapidly, they can now transfer the egg into the womb, and then at that stage, it can now attach or implant in the endometrial lining. Then we can say pregnancy has taken place. It is not fertilization that is actual pregnancy. Okay, fertilization is just like the second step. Let's say the first step is the intercourse or the IVF procedure. The second step is this fertilization, but fertilization does not guarantee that pregnancy will take place. No. So even after fertilization, the embryo form is supposed to multiply and then enter the womb. If it is happening inside the womb, and that is spontaneously, or what we want to call natural conception, all this is happening inside of the fallopian tube, and the embryo is moving down towards the womb, the uterus. When it gets into the uterus, it will now attach to one of the areas of the uterine lining, that is the endometrial lining. Then at that implantation phase, you can say pregnancy has started. Then the embryo continues to grow and develop. This development can be affected if the sperm is not healthy. If it's not healthy, it might not multiply enough for implantation. If it's not healthy, even if after implantation, it can still stop multiplying along the line, and then the woman will now have miscarriage. So this is how miscarriage can happen, but we'll talk about it next. So even conception can be affected if this sperm health is poor. So I hope what I'm saying makes sense to us. Second is increased risk of miscarriage. That was what I was just trying to say. So if for any reason we have maybe DNA damage in the sperm, it can contribute to early pregnancy loss. That is miscarriage. Miscarriage is anything happening after, well, for us in Africa, anything happening below 4 months of pregnancy is termed a miscarriage. You cannot handle any baby more than 3 months. But abroad, after 6 months, and lower than 6 months is miscarriage, because they can handle fetuses up to 6 months. gestational age. Let's not digress. So if sperm cell is unhealthy, like there is DNA damage, it can contribute to early pregnancy loss because it is impacting the developing embryo, like I explained. So sperm with DNA damage or structural abnormalities can increase the risk of miscarriages, especially, of course, in early pregnancy, leading to impaired growth, leading to impaired implantation. Okay, now we've talked about semen analysis being the way to know whether sperm count is okay or sperm motility is okay or whether sperm morphology is okay. Yes, but unfortunately, semen analysis cannot tell us about DNA damage. It cannot tell us about DNA fragmentation. It cannot assess it. Okay. What is used to assess DNA fragmentation is what we call meta-analysis. It's a higher level of semen analysis. So it is that meta-analysis studies, that is the investigation done to assess sperm DNA, and it has shown a significant increase in miscarriage rates in patients with high DNA damage compared to those with low DNA damage. That means it is a significant thing that the DNA of the sperm cell contributes to miscarriage. Okay? So sperm DNA fragmentation testing is helpful to know whether there is a genetic problem with the sperm cell and if that is what is causing recurrent miscarriages. Because yes, that is one of the major causes of recurrent miscarriages. When the sperm health is low, poor, with DNA fragmentation, the baby formed, the embryo formed, will not be able to develop properly, might not be able to implant, thereby causing early pregnancy loss, which we also know as miscarriages. So that is the second thing that poor sperm health can cause. Number one, infertility, inability to conceive at all. Number two, even when conception has taken place, the woman has seen that she's pregnant, pregnancy is ongoing, there is likely to be early pregnancy loss from 3 months and below because of the poor state of the sperm health. The third way that sperm health can affect pregnancy outcome is potential for birth defect. Birth defect means a baby born with some abnormalities. Now, even though birth defect, a baby is born abnormal, with some abnormalities, is not majorly from poor sperm health. It can contribute, especially when there is DNA fragmentation. If the DNA that is fragmented, the child inherits that particular one, then the child can develop and have some abnormalities. It can increase the risk of genetic disorders in that child and some birth defects in that child. Though it's not so common, it's not so direct, because the gene that is abnormal has to be inherited by the child. If that gene is not inherited by that particular child, the child will not have any birth defect. Okay, so we know now from basic biology, everybody has 46 chromosomes, and during embryo development or during fertilization, the man deposits 23 of those chromosomes, the woman brings 23 of her own chromosomes to form the baby zone, which is 46 chromosomes now. I'm digressing, but I just want to explain something. So out of those DNA fragmented cells, if the baby is taking the chromosome that is fragmented, then you can see birth defect, but it's not so common. That's what we are trying to say. It's not as common as maybe the man takes drugs during pregnancy. It's not as common as when the woman has exposure to toxins or radiations during pregnancy. Those ones will cause a higher level of birth defects than just poor sperm health, but it can potentially happen. That's what we want to take note of. So all these are how poor sperm health comes about and how it can impact on pregnancy outcomes. It can cause conception not to take place at all. It can cause miscarriages to take place even after pregnancy has started. It can also cause, to a minimal level, the baby coming out with some birth defects, okay? So how do we ensure that all this does not happen? We want our men to be intentional about improving their sperm health. It's not just about being able to do. It's not just about being able to produce sperm. We must have the sperm cells healthy enough to give us good, healthy babies. We want to have good, healthy babies, and it can be contributed to by the health of the sperm cells. So to improve sperm health, the general recommendation is to, 1, focus on a balanced diet. 2, include regular exercise on it in your daily routine. And substances. Then number 4, managing stress. These are the 4 major recommendations for improving sperm health. The 4 major recommendations are diet, focusing on a balanced, healthy diet for improving sperm health, having regular exercise, okay, avoiding harmful substances like toxins, illicit drugs, radiations, and then being able to manage stress. These are the 4 recommendations for improving sperm health. Remember, like I said, you can drop your questions in the chat box. Your chat box is at the lower right end of your screen. You are gradually coming towards the end of this seminar. So if you have questions, this is the right time to drop them. So let's look at these things one by one. Diet. Balanced diet is good, but there are some specifics when you are trying to improve sperm health. 1, focus on foods rich in antioxidants, like your fruits, your vegetables, and your nuts. They provide things like vitamin C and lycopene. These ones are responsible for preventing sperm damage and DNA fragmentation. So when you have a lot of antioxidants in your system, it can prevent damage to the sperm cells. Look for foods rich in zinc. Zinc is essential for production of sperm cells, also essential for motility. Okay, we can get zinc from our oysters, from beef, that is cattle beef now, and then from beans, from beans. Naturally, men like beans, so if you are part of the group that like beans, you are on the right track, because it contains a lot of zinc, which is essential for production and motility. Then folate. Look for foods rich in folate. Folate is responsible for DNA formation and sperm development. We can find folate in our green leafy vegetables. All our ugu, particularly things like ugu, okay? Your spinach, your water leaf, your shoko, your ewedu, all those green vegetables, okay? Your atama, all of them. Oha, all those vegetables. So if you do a lot of vegetables, you are on the right track. Beans also contains folate, and then you can also get folate from supplements, okay? Fortified supplements that have folate. You can get folate from them. So you can use supplements to get, if you're somebody who knows, you know that you're not very good at taking a lot of vegetables or beans, you might want to think about getting these minerals from your supplements, okay? Then another one is omega-3 fatty acids. This one also improves sperm health. We find it in fish, we find it in flaxseed, we find it in walnuts. Omega-3 fatty acids is also very good for women. So as much as you can, we also have it as supplements anyway. Omega-3 fatty acid is something that is also important for improving sperm health. Then our dairy products, but Dairy products are supposed to be products gotten from milk, but not all of them. We are looking for low-fat dairy products like yogurt or skimmed milk. So these are responsible for sperm concentration and also helps to improve motility. So let me talk a little bit about this. There are people who say when men drink a lot of certain things, then the sperm becomes thicker. It's true. If you do a lot of yogurt, it can help the seminal fluid also to have a thicker consistency. But the advantage of yogurt is that it will also help in large production of sperm cells and increasing sperm concentration, and also help in the motility of the sperm cells. As against some things like just kunu or just tiger nut, even though tiger nut is also very good for production, but it is specific for concentration of the seminal fluid, which gives that thicker consistency. Or they say men should take a lot of pap, or they should take a lot of Quaker oats, even though Quaker oats is good. But you know, things like pap, things like kunu, drinking a lot of it is not bad, but they can give a false impression of a thicker seminal fluid, particularly things like kunu and pap. They can give a false impression of thicker seminal fluid, which does not necessarily translate to healthier sperm cells. But things like yogurt, things like tiger nut, okay, things like low-fat milk, like your skimmed milk, will actually improve the sperm production and concentration and then motility. So that is the advantage of dairy as against just pap and against just kunu. I hope that makes sense. So generally, when it comes to diet, avoid fried foods for men, avoid processed foods, because they impact negatively on sperm cells by the production of by having some chemicals among them. The fried foods contains trans fat, which also impacts negatively on some of the other hormones and the production of these cells. Both for men and for women, we don't encourage fried foods for people who are trying to improve their fertility state. So that's that for diet. Number 2 is exercise. Men should exercise even more than women. Why? Apart from helping you to stay fit and stay in shape, maintain a good weight, it can improve sperm count because it boosts testosterone levels. You see women who do too much exercise, they begin to look masculine because exercise helps to increase testosterone level. So when women do too much of exercise, they start having masculine features. It's not just the muscles. They have masculine features. Why? Because they are increasing potentially their testosterone levels. So if men exercise a lot, increase their exercise rates, they are naturally boosting their testosterone level, which will not just stop at giving them muscles. It will also improve their reproductive health. So if you aim for 30 minutes of moderate intensity exercise 4 to 5 days a week, you are good. So if you're not exercising as a man, you need to start exercising. Apart from giving you your 6 packs and your sculptured body that makes women to like you more, don't mind me. But yes, aside from that, the testosterone level which increases will also help to improve the reproductive health. So yes, add that to one of the things that you do regularly, 4 to 5 days every week, and you are having enough testosterone, which will make you look good, give you that 6 packs, abs and all that, but also help to improve sperm health and everything about reproductive health, because testosterone is the male hormone responsible for male reproductive health. I hope that makes sense. Okay, so finally, other factors, lifestyle changes. The lifestyle changes that you need to make to contribute to improved sperm health is the following. 1, stop smoking. Smoking, of course, you're inhaling or taking in a lot of chemicals, which, like we said, are like endocrine disruptors, and they can impact on the hormones of the reproductive system, and then negatively impact on their functioning, causing low production. Reduce alcohol, like we have explained. Alcohol also can act in this manner like chemicals and impact negatively. Alcohol causes a lot of issues, like even the DNA fragmentation we are talking about. Alcohol can be responsible if it is consumed in excessive quantity. And illicit drugs has the same effect, impacting negatively on the production of sperm cells, causing poor sperm health. Stress management, we have explained that if you are under stress, the stress hormones take over, and those stress hormones suppress the normal functioning of your hormones, causing, of course, low production, low motility, reduced sperm health in general. Maintain a healthy weight. That is part of the things that dieting properly and exercising will help you achieve. A healthy weight. If you have excessive weight, for people who are obese, it causes a high level of female hormones in the system, suppresses the male hormones, and of course cause reduction in the production of sperm cells. Avoid exposure to heat. We have explained that during the course of this discussion. The testes have no business with heat. They are particularly created and brought out of the body. See, the testes is the variant of the ovaries in the woman. As a man has two testes, that's how a woman has two ovaries. But the woman's ovaries are inside of her body, in the pelvic region. They are supposed to have warmth around them to incubate the eggs. Let me put it in that context. But for the man, the testis is brought out of the body because it is supposed to be cool. So anything that will cause heat around the groin for the man is an enemy to that man, because it is killing the production of sperm cells. If you are at home, please wear boxers. That's the essence. Don't even wear joggers. Wear boxers at home. Cotton-based boxers. If you don't like boxers when you are going out and you prefer your briefs, that's the best. You see those European briefs, it's still the best kind of underwear for men because it is pure cotton, very lovely cotton, very comfortable, and allows aeration around the testes. So it is encouraged. Please, men should not wear skinny jeans or tight trousers. It might be in fashion, but it is destroying sperm production. Little wonder why we are having higher levels of men with low sperm count in our time. Avoid exposure to toxins. Yes, a man has to work, but if you know that your job exposes you to heavy metals, you know, maybe you work in an industrial site where you are exposed to a lot of chemicals, you have to do more. So anytime you are off duty, you have to focus on detoxification, improving diet, avoiding all these other things like smoking and alcohol, and stress and drugs, because you are already at a disadvantage. We will not say stop work. Of course, you have to take care of your family, but good enough, the people that employ people at these jobs, give them opportunities of having offs. That is the essence of the off. That is the essence of the off. The essence is so that you will take time to come out from that environment, rejuvenate your system, take supplements, do detox, remove things that the chemicals that have accumulated from your system, so that your body can function well. And you will notice that when people are to take these jobs, they tell them that the recommended standard is you work 2 weeks in and 2 weeks out. If the rig or site, as it were, is in your residential area. And for those who travel offshore to work, even when you have traveled to the rig, you will see that they will tell you, maybe if you work 1 week, you take some days off. You won't be on site. It will be your rest period before you are not supposed to work straight number of days like that. But you see people working 30 days straight because of their daily allowances. But it is wrong, because it is destroying the system. It is dangerous. It is not designed to happen that way. So please avoid exposure to toxins as much as possible. Okay? Sleep adequately. 6 to 8 hours of sleep every night is essential for improving or maintaining good health and, of course, reproductive health as well. Use supplements. We've talked about that. There are supplements designed for men. You will get all these trace elements and minerals that you might not always get from food. Our food these days, we cannot trust them so much. If you cook fresh food, it's difficult to cook every day because of the cost of things. If you cook and store, because of NEPA, you might need to warm over and over. And when you warm like that, you have removed all the nutrients in that food. So it is important to help your system with supplements because you might not be getting everything you want adequately from your food. If you think you have a problem with your sperm health, please see a doctor. It is very sad, and I see this a lot. You see men, some of them are corporates, going to work. They will just gather around all these herbal people that sell all these shots, and they say this is manpower for boosting man performance or boosting man's sperm and things like that. You might not know what you're consuming. Some of those things is just Viagra that they grind and put in some things. Funny enough. And then a man is able to have erection and maintain erection and things like that. Some of them is just herbs for performance. Performance does not equal fertility. We have emphasized this as much as possible. Performance does not equal fertility. So those shots and those mixtures, concoctions that men take, you see them in the morning, they are going to work, they just branch these women and patronize them, take a shot or take, some buy the bottle and go home. Those things might not be the best for improving sperm health. If you think you have a challenge with sperm health, please see a doctor that can best advise you on how to manage the condition, what exactly the challenge is, and how best to manage it. So this is the end. We spent more than 1 hour. I'm so sorry for that. Let's just quickly take the questions. Thank you all for joining. Very impressed with today's attendance. Let me just read the questions that we have here. Margaret says longest time. Yes, longest time. Thank you too for joining us in today's seminar. Good evening to Mary. Thank you, Favor. Okay, I think the only question I have here is from Favor. It says, it always feels good to listen to your, to relieve, and a relief to listen to your fertility lectures. You are the best fertility instructor. Thank you very much. Okay, so the question is, apart from unhealthy semen, what else can cause miscarriage? Wonderful question. Thank you for that question, Favor. Very important. To know what causes miscarriage, you need to know what causes pregnancy. So number one is the sperm, and we have said that sperm can also contribute to miscarriage if the sperm is unhealthy. The second thing that contributes to pregnancy is the egg. So if also the egg is unhealthy, even after fertilization, fertilization might not occur, but even if fertilization occurs, if the egg is unhealthy, then pregnancy might also not happen. This month, we talked about sperm health, improving sperm health. Next month, we are talking about improving egg health. So look out for that lecture next month. We will also expatiate and explain that. So if the egg is also not healthy, it can also lead to miscarriages. The hormones is another thing that contributes to pregnancy, especially for the woman now, because for the man, the hormone will make the sperm not to be produced. But in the woman, there are hormones that are responsible for production or maturation of the eggs, and then there are hormones that are responsible for maintaining or sustaining the pregnancy. If those hormones are deficient, then miscarriage can also occur. So egg health is important. If it is deficient, miscarriage can occur. Hormones are responsible for maintaining pregnancy. If they are deficient or defunct in their activity, it can also lead to miscarriage. Then the womb the state of the womb can also lead to miscarriage. If the womb is not conducive for pregnancy, if like maybe the temperature of the womb is higher than normal, or the endometrial lining of the womb is not optimal, maybe the endometrial lining is too thin, implantation cannot be sustained, those are the things that can lead to miscarriages. Then genetic problems of the egg can also lead to miscarriages. If there's a genetic abnormality in the egg will also not mature, will not grow, the embryo will not develop, and then it will eventually lead to the death of the fetus and then miscarriage of the pregnancy. So common things that can cause miscarriage: poor egg health, imbalanced hormones, and inconducive womb environment. Inconducive womb environment. These are the three major things that can also contribute to miscarriages, in addition to poor sperm health. Thank you for that question. Very important. Margaret is asking that, does someone that works in a laundry house as a presser have low count? So a presser is the person that does the ironing. Under normal circumstances, the ironing should be like on a high table, okay? That's what I assume it should be. A high table, you put the clothes there and iron. It shouldn't directly. But if the environment is maybe unusually uncomfortable, and then the person's clothing is also not comfortable, it might contribute. But directly, just working in a laundry house should not cause low count, because a laundry house is not supposed to have toxins. It is detergent, especially if the person is just a presser. It should not contribute to that. And even if you are a washer, you should pour the detergent in the washing machine, and the washing machine does its business. Okay, so under normal circumstances, it shouldn't directly lead to low sperm count, but nothing is impossible, especially if other conditions are not optimal. Thank you also for that question, Margaret. Do we have any other questions? Do we have any other questions? I want to look at the WhatsApp group now to see if we have any questions there. Okay. No questions here on the WhatsApp group. No questions. No questions on the WhatsApp group. So any questions? A few more minutes. Let's take 2 more minutes or 3 more minutes. Yes, Kike Lomo is asking, why do I see black spotting a day before my menstruation and then also end with it? Okay, Kike Lomo, these kind of questions are taken during our support group meeting, not during the seminar, because in the seminar we focus on the topic of the seminar. So subsequently, any fertility related question you have, bring it during the support group meeting and ask on the, like, it's a meeting, it's an online meeting like this, and we can take any questions. But for the seminar, we focus on the topic we are teaching. But I will answer you for today. So the black spotting you see is what we call altered blood. Altered blood. What it means is that the menses has started, but the flow is still very slow. So that time it takes to travel from the womb to your underwear, the blood would have altered. By alteration, it means it would have mixed with the air, and then all the oxygen has gone out, and then you see it as black blood. That's just what happens. So it is altered blood. Also, when the period is ending, the same thing, the trickling of the last flow, it comes slowly, and by the time it gets to your underwear or to your pad, it is altered. Okay, you know, if you have a cut and you bleed, after some time, you see that the blood darkens. It is because the oxygen has left it, and then you have deoxygenated blood. Deoxygenated blood is usually dark, while oxygenated blood, that is blood with oxygen, is brighter red in color. So it's not a problem. It's not a sign of infection or any problem at all. It is just altered blood. Don't worry about it. It's a normal thing. What you can do is, when you know your period is about to come, you can do less sugar more warm fluids to help the flow to be faster, so that the time it takes to come down will not be so long, causing the alteration of the blood. But truthfully, it's not a problem at all. It's not something that you should be worried about. I hope that answers your question, and I hope that makes sense. So 1 more minute. Okay, I said 1 more minute. 1 more minute to see if we will have any other question. Let me check again on the WhatsApp group. No question here. Okay, yes, Mr. Cyril is asking, is there a particular sperm color that is capable of impregnating a lady? Because I see some sperm looks thicker and a bit brownish, while some is whitish. Okay, obviously you joined us late. If you joined us early enough, we had already answered this question. So we said that sperm health, excuse me, is dependent on 3 parameters: the count of the cells, the motility of the cells, and the shape of the cells. In any semen, the ejaculate, it consists of the semen, but the semen is made up of 2 parts: the seminal fluid and then the sperm cells itself. The seminal fluid is just a carrier of the cells. Now, that seminal fluid is produced in the prostate gland, while the sperm cells is produced in the testes. The seminal fluid carries the sperm cells when they are being produced during ejaculation. So the seminal fluid comes out from the prostate gland, the sperm cells come out from the testes, they mix, okay, and then pass through the urethra during intercourse for ejaculation. Note that the seminal fluid is largely dependent on diet. So depending on the kind of things you eat, it is liquid. Okay, it is liquid. So just because it is liquid produced in one part of the body, it is just resultant on what you have eaten. So if you eat a lot of things that will cause production of pure white seminal fluid, that's what it will look like. If you eat a lot of food that are colored, let me use that word, and will impact on the production from the prostate gland, you will have seminal fluid that is off-white or maybe brownish or something like that, as against those that have whiter semen. But the color has nothing to do with ability to fertilize the egg or to cause pregnancy. What is responsible for that is the cells themselves. So no matter, though color can be indicative of some things, like some infections, there's some infections that reveal, that is, the color of the semen reveals the kind of infection that somebody is having. There are some cases like that, but under normal circumstances, that a sperm is very white and another one is off-white, a little, creamy in color, or tending almost towards brown, doesn't mean it is a healthy sperm or not a healthy sperm. No. So for infection, you will not see sperm looking greenish or reddish or deep yellow. That can suggest that there is probably an infective process going on. Okay, but that this sperm is white doesn't mean it is healthy. No, it's just a function of what the person has eaten. And that another one is off-white, creamy, a little bit brownish, doesn't mean that it is unhealthy sperm. No, it's just a function of diet, how hydrated you are, you drinking a lot of water, all those things, contribute to the production and the color of the seminal fluid. Our time is up. So we want to say a very big thank you. I love you guys. Thank you so much for being part of the seminar this month. Without you, we'll be wasting our time here. So we appreciate your time. We appreciate your data. I'll not stop saying it because I know how terrible it is to get data nowadays. So we appreciate your time. We appreciate your investment in data to be part of this program. If you are not here, it will be very boring to be here alone. So I want to say a very big thank you for being interested in improving your knowledge of your fertility health. Remember what we say, learn to teach others. When we are having our gists, when we are having our discussions, wherever we find ourselves, amongst friends, among church members, whatever, in your social gatherings or religious gatherings, when the topic comes up, whatever you have learned, please be sure and confident that you are learning the right thing and share that information, because whatever you share might just change someone's life. So continue to learn to teach others. I love you so much. Thank you, Margaret. I love you too. Thank you. God bless you too. Thank you all very much. So thank you. We'll make the link available for those who were not able to join, and hopefully they will also be able to gain something. Thank you very much. God bless you all. Enjoy the rest of your evening and stay blessed. Bye-bye. Bye-bye, everybody.
All right, bye, Doc. Bye, everybody.
Bye. Thank you. And good night. Have a good evening.